Idaho Matters podcast is brought to you by St. Luke's On-Demand Virtual Care, which allows patients to see a provider from their home using a computer or smartphone with on-demand care for common ailments, such as a cough, sore throat, or a sinus issue. More information at stlukesonline.org. Idaho is a big state, and it covers a lot of territory. Idaho Matters wants to take you to every corner of the Gem State by visiting all 44 counties, and we need your help to do that. Email us your story ideas at idahomatters@boisestate.edu for our new series we're calling Idaho 44. And be sure to join us each weekday at noon and 8 on Idaho Matters and travel the state with us.
From the studios of Boise State Public Radio News, I'm Samantha Wright, filling in for Jimmy Gaudette. This is Idaho Matters. Hundreds of people have been exposed to rabies in Wyoming. Eli Lilly has a new GLP-1 pill to help people lose weight. Doctors may become dependent on AI, and a China company has built the world's first gestation robot. It's Wednesday, time for our Doctor Roundtable with Dr. David Pate, former CEO of the St. Luke's Health System and the co-author of the book Preparing for the Next Global Outbreak. Dr. Pate, hello.
Hello, Samantha.
If you have a public health question, send us an email at idahomatters@boisestate.edu. And we have a couple today, which we will cover. But first, there's a scary story out there out of Wyoming. Officials are worried that hundreds of people could have been exposed to rabies at Grand Teton National Park. Can we talk about this case and about bats and about rabies?
Yes. So rabies is actually the most lethal virus that infects humans that we know of. If untreated, and really what treatment means is that you must give what we call post-exposure prophylaxis. That means right after you think you've been exposed, you've had a bite or whatever, unless you get the rabies vaccine, it is nearly 100% lethal. By what that means, what I mean by that is, I think in the 20th century, so we're looking in the 1900s, I think in that century, I think we have 10 documented cases of people who survived. Now, surviving doesn't mean you recover to good health. I think all of those people had severe neurologic defects, but 10 people in a century is not where you want to put your odds. So what is rabies? Rabies is a virus that it's an RNA virus, and it infects dogs, wolves, foxes, coyotes, jackals, raccoons, skunks, ferrets, badgers, and bats. Now, here in the United States, most cases of rabies are related to dog bites. Not all, but most. In other parts of the world, bats may be far more common. And the reason that even makes a difference is that there are actually two forms of rabies, how it manifests once the disease sets in, which, as I said earlier, is now too late. Those people are going to die. So what happens is when you get bit, whatever you get bit by, bat, dog, whatever, the virus is introduced into the wound by the saliva of the biting animal, and then it travels to what we call the peripheral nerves. So the things that give you the sensation of, touch and feel in your hands, your feet, those kind of things. It starts in those peripheral nerves, and then it makes it up to the brain. So if you knew you had to be bitten, your preference would be get bit in the foot. because the further it is to get to the brain, the more time you have to
Mm.
get vaccinated. And the reason that we can actually treat rabies and prevent rabies if we get it soon enough after you've been exposed is because it has a very long incubation period. And that means that the time from the virus is introduced to the time that it can cause the disease is typically around 20 days to 60 days. It can be far longer. And so we have some time, but you don't have forever. And
Mhm.
so that's why we have to do the prophylaxis, because once it gets to the brain, then we either see what's called a furious form, which that's especially when you get dog bites, where
Mm.
people get hyperactive, aggressive, agitated, might have hallucinations, those images of somebody foaming at the mouth, seizures, excessive sweating, those kind of things. That's the furious form. The form that's more common with bats is the paralytic form, and that's where you feel the ascending weakness, like your feet and legs are weaker than your arms, loss of sensation, paralysis, perhaps. But invariably, in both cases, they progress to coma and then death. Once that disease, those one of those two forms of brain disease sets in, with the furious form from bats, you've got basically 5 days till you're dead. With the paralytic form, that's more common. I'm sorry, I got headed backwards. The furious form with the dog bites, that you typically have 5 days till you die. The paralytic form with the bats, once that neurologic stuff sets in, you got about 13 days till you die.
Wow. Okay, that's encouraging. So the case here was some cabins at a lodge that they found bats in. They became, I think, bat infested was the story that we read, and we'll link to it online. And so they're worried that people who have stayed in these cabins, there were 8 of them, might have been bitten by a bat, like at night when nobody was paying attention, or when they were in the cabin and just didn't notice or were aware. And we've talked about this a little before, but is this a concern that people can get bit by a bat and then not know they got bit? Is that really a thing?
Well, it is because it is if you don't know that you've been bitten by a bat, and of course, we don't know whether that bat is rabid, but if you don't know, then you're not going to think to go to the doctor or hospital to get the rabies vaccine. And if that bat was rabid, but which higher likelihood because bats aren't just looking to go bite humans necessarily, so that increases the chances that they have rabies. But if you don't know it, then you're not going to get the vaccine. And if you do get rabies, then and by the time you show the symptoms, it's too late. What happens is, in this particular case, the bats had taken up roost in the attics,
Mm.
and so there wasn't a sufficient barrier for the bat, because bats aren't going to stay in any one place. They have to go out and look for insects at night to eat and come back. So they're going in and out, and so there obviously were defects that were allowing the bats to get into the house. Some defect around the roof line probably that
Mm.
allowed the bats in there. And the problem is bat roosts generally have about 30 to 100 bats.
Oh, wow.
Now, what alerted the folks there to the issue is apparently they found 4 dead bats. So, dead bats are
Ugh.
kind of like your clue that, hey, we should look at this. Now, with that said, bats die. They, unlike the movie, they are not immortal, and so they do die. But the fact that they found 4 dead ones was concerning. The good news is so far the bats have not tested positive for rabies. But
Mm.
what happens is when you have that many bats, now the chances that there might be one or more with rabies has increased. And what happens is at night, if you're a deep sleeper,
Mm.
uh, then uh, what can happen is they can bite you, and their teeth are extremely small but razor sharp. So it's not like a dog bite where you're gonna definitely be aware and you're gonna definitely feel it and you're gonna definitely see it.
Yeah.
Bat bites can be harder to see, and they can occur without you feeling it. So that is the concern that these people just had a lot of potential exposure to these bats.
Okay, Dr. Pate, I want to pivot. We've got a listener question, which came from Lori. She's diabetic. She takes Ozempic for her type 2 diabetes. It's been working very well. And as a side effect, she's lost a lot of weight, which she likes, but it's a shot. And she wants to know about the new weight loss pill that Eli Lilly is testing now. They plan to try and get it on the market by the end of the year. Dr. Pate, can you tell us about this pill?
Yeah. So the medicine that she is referring to has really been transformative in both the areas of diabetes treatment and obesity treatment. And I say treating obesity because we have learned a lot. We still have a lot more to learn, but obesity is not a lack of willpower. Obesity is an actual disease, and we have found out how very complicated it is and why so many of your listeners can probably relate to things like yo yo diets and doing things, losing weight, but then gaining it all back later because we've realized that the cells of your body actually get reprogrammed with obesity and think that that higher weight is what they should work at maintaining. So this medicine that she's talking about that she's been taking as a shot, and now they're developing the pill for, is a medicine that mimics a hormone that is produced by your gut when you eat. That tells your pancreas make more insulin because you need to absorb the sugar from the food and turn it into energy, and then also sends a message to the brain to say, okay, I can see that we're eating, and now there's no longer a need to continue doing that. And so that's what that shot does. Now, the good thing about the shot is that it basically lasts about a week. So it's not like you have to take a shot every day, like a lot of diabetics are used to. But very few people like taking shots. So the exciting thing about this pill announcement is it's the same medicine, but they've figured out a way to give it by mouth without it being destroyed by the stomach acids. And what they have found from the preliminary studies, they've done the first two phases. We got to do another phase, but it's showing that people at after about 36 weeks. So we're talking about less than a year, but about 9 months or so. They are losing 9 to almost 15% of their body weight, and part of that depends on the dose of the pill. So this is very exciting. And now it's not a cure all, but it is very exciting. One of the problems to it is that it does have a lot of side effects, and about 10% of people found those not tolerable and stopped the treatment. But there's also a significant percentage of people that have side effects with the shot as well. But this is an advancement. It would give people an option one of the big problems about the shots, very expensive.
Mm.
Now, what we don't know is, are the pills going to be less expensive? But they certainly will be of interest to probably a lot more people if they do get approved.
We talked about this debate during COVID with the COVID vaccine. In the debate, a lot of people don't want to get shots. Um, Sometimes very severely don't want to get shots. And so I think that's part of the appeal of a pill for these GLP-1 drugs. Um, and I was looking at the latest test results from Eli Lilly, said that people lost more than 12% of their weight, body weight. That's up to 27 pounds. And you mentioned the side effects, and there were some heavy duty side effects. The rate of nausea with the folks who were trying it out was 33%, 24% actually threw up, had vomiting. But there were some positive results I saw besides weight loss. Everything from lower cholesterol, triglycerides, blood pressure, may help reduce your A1C levels. There seems to be good and bad in here. And they're pretty serious about it. They're building a stockpile of the pills because they're going to try and get them approved by the end of the year. So, could we see this on the market soon? And is there anything you're worried about with these?
So, yes, we could see them on the market. I would imagine not this year, but I could fully imagine that you and I, or Jim and I, are having this conversation early next year. I think it could be on the market that soon.
Hmm.
I really like the way that you phrased it, Samantha, that, there's good and bad with these medicines. And that has been what has been lost with the vaccine stories, everything else. It's true of anything that you take, vaccine or medicine, there's good and bad. And even with Tylenol, there can be some side effects that some people have for that. So, no, when we say a drug is safe, it doesn't mean that you can take it with impunity and that no one will have any side effects. That's not what safe means. But this drug, um, while it certainly does have a lot of side effects that some people don't tolerate well, just as you mentioned. On the other hand, I don't even think we know all the benefits yet. As a doctor who has managed chronic medical illnesses, I can tell you that at the root of much of the treatment for those chronic diseases is usually a an effort to manage weight and exercise and those kinds of things, because most conditions do better when you get the weight closer to ideal body weight. You mentioned some of those very positive signs with cholesterol, blood pressure. It is not a leap to then think that this might reduce heart disease. And in fact, we are already seeing evidence that it may help in certain types of heart failure, certain other cardiovascular diseases. It might decrease the risk of stroke and heart attacks. Those studies are going on, and I think we will be seeing evidence come out in the next year to either validate that or refute that. There is already some evidence coming out. I wouldn't say proof, but evidence coming out to suggest that it may lessen your likelihood, at least in some people, for dementia. There's a lot of benefits. In fact, one other drug, not the one we're talking about, but a related one, has been proved to decrease sleep apnea. And it's
Hmm.
actually gotten approved for that indication. So I think we've only begun to realize what the potential benefits of this, because our body weight is related to so many things. Now, on the other hand, we are finding some other issues. For example, uh, people on the injectable drugs, so I assume it could happen with the pills, but we'll see. But with the injectable drugs, that we have to be careful about is them developing a condition called sarcopenia, which is just the Latin word, medical word for mean loss of skeletal muscle. And that is that if you're obese and you take this medicine just with the intent that this is going to take care of your obesity, but you're inactive, it will reduce your weight, but it will reduce fat and muscle. And it can reduce the muscle to the point that people are weaker, less steady, and so it can set them up for a whole host of problems. The way around this is to look at this when it's being taken for, particularly for weight loss, but even in diabetics, that it's part of a whole bigger program. And that has to mean you need to do some exercising. You still need to pay attention to diet. We don't want people to get vitamin deficient or nutrient deficient because they're not eating as much. So we have to be careful about that. But it's got to be balanced. It's got to be exercise, some resistance training to try to maintain that muscle, etc. But these are phenomenal drugs that are giving us better results than anything we've had before.
Wow. Okay. And Dr. Pate, listener James sent this one in, and after reading it, I'm pretty sure I am now living in the Matrix. A Chinese tech firm says it has built the first gestation robot and that it can grow a fetus to full term inside a robot's belly. And I guess the first question is this even possible?
Well, I would say, first of all, this is never an idea that I would have thought of. But there are some reasons that make me believe at least part of this idea certainly could be feasible.
Mm.
I'm having a lot of trouble with the broad representations of what this company is saying it's going to be able to do. But yeah, I could imagine that there are some limited circumstances where this might, strangely enough, be of use.
Oh, well, okay. So apparently, and we're gonna link to the article. Apparently, they kept not the Chinese folks, but the Children's Hospital of Philadelphia. Apparently, the hospital there kept some premature lambs alive in a similar fashion outside of the womb in what I would essentially call a fancy plastic bag, and they pumped nutrients in there with a tube, and the lambs, were okay, but they were already partly grown the natural way in a lamb's belly. So that's different from what this robot is supposed to be able to do, which is from, conception to birth, apparently. So, as a doctor, what kind of drawbacks or pitfalls come to mind with this particular idea? And we haven't even thought about the ethical ramifications. I'm just thinking physical.
Yeah, and I think that you kind of hit the main point for me, where you pointed out that with those lambs, they had already been conceived,
Mm.
developed as embryos, became the growing fetuses, became almost viable. They were born prematurely. And that's where I could see, okay, this could potentially make sense to me. What we have is situations where we have mothers, for any number of reasons, that may be having perfectly healthy uh, infants or multiples, but they are delivered prematurely. That we can't stop the premature labor, or the membranes ruptured, and so we really don't have much of a choice other than to deliver. And now the baby is too early. So they go to our neonatal intensive care unit, and then there's multiple concerns, of course, but one of the biggest is is that their lungs haven't developed sufficiently. And so, in the worst cases, we have to support that lung function. I could see where this might be an interesting thought if we got better outcomes, if it wasn't cost prohibitive. I could see where maybe this would be worth exploring for those very, very prematurely born infants that are already progressed well to that point in the pregnancy. I could see that.
Okay, two things I read that the company says, if you don't want to get married, or you don't want to carry a baby, this is the way to go. And that surrogacy is basically illegal in China. And that might give the robot making baby more of an appeal. So, are you worried about this actually coming to pass? I mean, along with the physical ideas behind this, there are ethical, there are spiritual, there are all kinds of things that just pop into my mind anyway. What are you thinking about?
Oh, so many questions, so many issues, as you say, and I have to be a little bit careful because my mother listens to this show, so I'm going to be careful. But um, so the first thing is, I have to say, I was really taken aback at their statement about if you don't want a wife. I mean, holy smokes! Um, now, first of all, uh, I think I think if there was a young man who thought it would be great to have a baby, but didn't want to um, have a partner in his life, I mean, there's a lot of issues. Wives are worth so much more than just having babies. You're gonna, having a child and God bless single parents, but it is a hard life. And babies benefit from having two parents, two different role models, two caretakers, etc. um, More disturbing to me, well, I'm not, maybe not more, but also disturbing to me is this issue that they say that the robot, it's involved from everything from conception to the delivery.
Mm.
Now, I know what conception means to me, and I am like at a loss of what to even
Okay.
say here, and don't want to get in trouble. But
Oh.
so there's that whole issue. But then the other issue is what do they mean? And of course, they're being tight-lipped about it. They won't say, and I understand. But to me, there's two ways to deliver a baby, through your abdomen with a C-section or between your legs. Now, what are they talking about with this robot thing? It would seem to me that it would be a compartment. You'd open it up like the trunk, and there's the baby in the robot because it should be a lot easier. But I don't even know what they're talking about, and I'm a little bit freaked out about all this part of it. So um, I'm not sure what to say.
I'm not either, and I think it's one of those wait and see things until it.
Yeah, there could be some very good uses. I don't want to discourage it, but I have a lot of questions.
There's a lot of questions there. Okay, so speaking of questions, there's a new study out that says doctors may be becoming dependent on AI, and frankly, this is a little scary. Dr. Pate, can you tell us about the study?
Yeah, this is interesting. It's one little use of AI in healthcare. We need to keep that in mind. First of all, this was just looking at how AI was used to assist gastroenterologists in performing colonoscopies to identify polyps. Now we use AI in a number of different ways, and I actually I'm big on AI. I do think I think it too, we have to be careful. And I think we have to look at AI being a tool rather than a replacement for physicians. I think when physicians have the added benefit of AI, it can improve what we do. If we're trying to, really just turn everything over to AI, I think we're going to be in trouble. But in this case, what they did is they used AI to look at the video inside the colon. If you've had a colonoscopy, you probably know that while they have the scope up there, that they have a TV monitor in the room and they're looking at it and they can see stuff blown up on TV. And so the AI looks at it, and when it sees something that looks like a polyp, which polyp is just a little growth on the lining of the colon, although it can get very big if it's been there for a long time. And why we look for polyps is that those there's a couple of different types. One is innocent, the other one precancerous. And we want to identify that because if we do and get it out while it's precancer, you're basically going to be prevented from getting colon cancer. And so the point was that when these doctors were using the AI to identify the polyps, and then all of a sudden, what they did is to just turn the AI off. What they showed in their study was evidence that suggested that now the gastroenterologist didn't identify polyps very well. It's a little hard for me to believe. It was a matter of months, and I'm not a gastroenterologist, but I know I do forget things, but I typically don't forget things that quickly, and I really don't. I think there's probably some other explanations for all this, but it's a concern, and I think it just means that we shouldn't just turn things over. We still have to take primary responsibility, use AI as a tool to help us. And there's some great ways that that's being done. So, for example, in dermatology, uh, we've seen some very encouraging results where you feed millions of images into the computer, and it does machine learning, and it can spot lesions on the skin and identify them. Oftentimes better than a dermatologist, but uh, again, we have to realize the limitation. First of all, they're not, uh, completely error free, and so you still need the human expert to look. But second, if you find the skin lesion, then what are you going to do about it? You need the doctor to treat it. AI is not going to remove it or biopsy it or whatever. So we just have to realize it's a tool, not a replacement. Another area where this can be extremely benefit is in diagnostic imaging. And for like mammograms, mammograms are very difficult to read. Not every place, like at St. Luke's, we do have breast specialists in imaging, but most places can't have that level of expertise. It could help a radiologist that's not an expert in reading them to identify problematic spots. Another way it could be done is to like all the images that a radiologist has to look at and read that day, you could pre-screen with AI, have AI sort out, hey, these are the worrisome ones. Start here and start reading these, and these others appear to be more normal, and so you can put them at the end of the stack. So there's ways to use it. We just have to be careful.
And I think that's the trick, right? Is to make sure there's still humans involved to take a look and see.
Exactly. Balanced.
Balance.
We need it. Look at it as a tool, not a replacement.
I think balance is the word of the day. We'll just adopt that for everything. Balance is good in all things.
Amen.
Dr. Pate, I can't thank you enough as always. This has been wonderful. We really appreciate it.
My pleasure.
We've been speaking with Dr. David Pate, former CEO of St. Luke's Health System. He's also the co-author of the book, Preparing for the Next Global Outbreak. It's a great read. If you have a COVID-19 question or a global outbreak question or a public health question, send it to us in an email, idahomatters@boisestate.edu. We'll answer it next week.
You've been listening to Idaho Matters from Boise State Public Radio. I'm Gemma Gaudette.